Welcome back to the Better Health Now podcast. Today I'm sitting down with Dr. Lance Justice, OB-GYN here at Coleman Regional. Dr. Justice attended medical school at the West Virginia School of Osteopathic Medicine in Lewisburg, West Virginia, followed by a residency in obstetrics and gynecology at Oklahoma State University Medical Center in Tulsa, Oklahoma. He was named the American College of Osteopathic Obstetricians and Gynecologists National Mentor of the Year in 2022. Thank you for taking the time to sit down with me today.
Yeah, thanks for having me.
Looking forward to discussing the work you're doing here at Coleman Regional. So to begin the conversation, what was your path to get to Coleman Regional? I know you were at Guntersville prior to coming here.
So I did my residency in Tulsa, Oklahoma. So finished residency in 2011. And after that, I went to another facility in North Alabama, and I was there for 12 and a half years.
Okay. So what ultimately, while you were in medical school, what sort of interested you in pursuing a residency in gynecology? And was during your rotations, did you have any other areas of study that interested you?
So it's kind of interesting. So I get that question all the time from patients. Of all the specialties, why choose OB-GYN? And it's interesting, in medical school, one of the three things I did not want to do is pediatrics, psychiatry, and OB-GYN.
And here you are doing OB-GYN.
Exactly. God's got a way of humbling us.
Yes, for sure.
So one of the things I enjoyed is I enjoyed relationships.
Mm-hmm.
You know, I enjoyed the clinic time and getting to know your patients. I enjoyed the surgery, not so much where you live in the OR, not so much where you live in the clinic. And when it comes to women's health, you know, if you ask a pregnant lady to stand on her head, she's going to do what you ask her to do. Whereas if you tell you and I to stop smoking or, you know, lose weight or exercise, we're probably not.
Yeah, it'd be a little tougher.
It'd be a little hard. Whereas women's health, it incorporates everything.
So from going to school in West Virginia to then going to Oklahoma to then coming to Guntersville, so what ultimately kind of brought you to Alabama in general? Were you looking at that as a place to call home? Did you have family here that kind of prompted that move?
So I went to high school. I'm from Scottsboro.
Okay.
Originally, went to high school at Randolph in Huntsville. So my wife's from Boaz, so we just wanted to migrate home.
Okay.
To be with family.
Yeah. So the area of the work that I kind of wanted to discuss in today's conversation is menopause, and particularly the treatments that you recommend to your patients. So approximately 85% of menopausal women experience a variety of symptoms and severity. What do those symptoms typically look like from the patients that you see coming in?
Good job. You've done your homework. Quoting numbers there. So, you know, especially post-COVID, menopausal symptoms range from hot flashes, night sweats, perimenopausal symptoms. You can have insomnia, decreased libido. So it kind of ranges from those symptoms and increases in severity the older you get.
Okay. And so when does that when does the start of menopause typically happen? And is it a wide range, or is it pretty narrow as far as the patients that you see?
So it's wide. So perimenopausal transition occurs around 40 to 45.
Okay.
The average age of menopause is 51, and that can last anywhere from 5 years to a whole decade.
Okay.
So after menstrual periods stop for 1 year.
Okay. So what does the process typically look like for patients that are coming in due to severe symptoms, and how do you typically determine the best treatment for them?
So it's individualized. So every patient's different. That's one of the things I enjoy about women's health is, you know, it's not cookie cutter medicine. So you got to take each patient, listen to their symptoms. I feel like we as physicians, that's where we fail, is if you listen to your patients, they're pretty much going to tell you exactly what's wrong with them. You just got to listen. So, you know, there's blood work. You got to rule out other issues that could be causing their symptoms. And then it's just based on what symptom bothers them the most. Some ladies, hot flashes bothers them the most. Some ladies, night sweats. Some ladies, weight gain, lack of sleep. So it just depends on which symptom they're predominantly having, and the treatment is tailored according to that.
Yeah. So is there like what do you see as the most common symptoms, and what is the most common treatment that you typically are prescribing on a weekly or a monthly basis throughout your career so far?
So hot flashes, night sweats are a big one. Weight gain. So it's hard to identify just a symptom that is the most common, because it's usually a constellation of a variety of things. Hot flashes, night sweats. Sex drive is a big one, and weight gain is a big one.
So from when the patient would begin doing treatments to when they start seeing the results, how long does that process typically take?
Usually 4 to 6 weeks. They'll
Okay.
notice some symptoms. Sleep improvement usually within 2 to 3 weeks.
Okay. So with the name of this podcast being The Better Health Now, we talked a lot about, the desire and the interest that you had in women's health and in pursuing that career. What does the promise of getting better every day, how do you apply that to the work you're doing, and what does that promise mean to you?
So Better Every Day, one of the things that was appealing to CRMC is the investment that they have not only in the community, but for the best possible patient care. That's one of the things that interested me. If you look at just the capital expenditure here, there's a press release last year, $30 million just in capital expenditure. That let me know they're invested. They're invested not only in the short term, but also in the long term. And that's not something you can do every day. That's something you have to do for the future. And that was one thing that drew me to CRMC.
Yeah. So if you could see one news article about the work you're doing or the work your colleagues are doing here at Coleman Regional in the next year or in the next few years, what would you want that headline to say?
So CRMC continues to build upon that vision, better every day. It's a process. CRMC continues to be a premier destination for not just women's health care, but for all health care, and continue to build upon what the legacy that is already here.
Well, thank you so much, Dr. Justice, for taking the time to sit down with me today. I continue to look forward to the impact that you'll have in your patient's life here at Coleman Regional. If you're listening and you want to learn more about Coleman Regional or any of the work being done here, you can visit our website, colemanregional.com today. Thank you again, Dr. Justice, for being here.
Thanks for having me.